So we're talking about the future vision for advanced and consultant practice. And we've got quite a compelling vision. We've developed it across the arm's length bodies, across the system, with employers, with stakeholders, and most importantly with citizens who use our services. And the vision really has been one to think through how we create a workforce for the future that is able to meet the needs of a complex population, able to meet the needs of employers who have very, very challenging services to deliver, and the ability for us to enable the workforce to truly realise its potential and its contribution within services. And this is not about trying to create many doctors, this is about trying to create the workforce that the population requires, and it's about really trying to understand how we train that workforce as intelligently and as well as possible to make sure that the workforce we create are absolutely able to deliver the services that we require as the patients that we are, as the people that we are, and as the carers that we are. Really, really important. But in all of that, we really need to think about how we really value and how we champion the professional identity of those professions too, because we are proud of our professional backgrounds and we must build on that, not try and develop something different and new. We need to create a workforce proud of who they are, able to broaden their skill set to meet the needs of their populations. So what we need to be thinking about is how we do that and how we put some infrastructure around that that is proportionate and appropriate. And so part of the work we're looking at through our vision is how we create an underpinning infrastructure to support us to deliver a workforce for the future for the population. So when you think about that vision for advanced and consultant practice, what we really want to do is to create training routes for people. So I can see my career, I can map out my career and really understand how I can become the clinician that the system needs me to be, that I want to be. And there'll be different routes to train. I'll be able to train in a nationally recognised specialty route, or I'll be able to train in a bespoke route that meets truly the needs of my local population and my employer. And there'll be different ways that I can achieve that training. The apprenticeship route is now open to us, which is a fantastic development, and enables us to train people on an apprenticeship pathway in the workplace, really being able to meet the needs of local systems. We will still have employer or self or HE funded routes to train, and we're looking to develop an equivalence route which enables people to evidence that they meet the same standards. They may not have the master's degree, they will have component parts of that and a lifetime of experience to bring to the table that we can recognise. Because our workforce is a combination of our future workforce and our current workforce, and we value both the same and need to create equal opportunity for both valued parts of our workforce. And then we need to think about how do we create a national recognition and a quality assurance of the programmes that we're running, so that people who are attending programmes or employers who are training their staff can really have an understanding that the product that they are purchasing is quality assured, meets the standards and the transformational aspirations that we have as a system that we have co-produced together. The rest of our vision really thinks about how we train people differently in the workplace, because as a service user myself, I need to know the staff are skilled in what I need them to be able to do to help me. And so we are looking to how we develop workplace supervision, how we really start to understand that the development at the bedside, in the consulting or in the community of clinical skills in service, training people side by side so that we start to build professional respect, trust, mutual appreciation of each other's skill sets as we start to rethink what that modern team looks like. But to do that, things like clinical supervision, educational supervision, really important parts of how we really build a valued workforce where we have revolutionised the attainment of clinical skills in service. Very exciting, takes some thinking about and us working together with universities across the system, with our medical colleagues to really think about how we offer that support to learners in the most cost-effective and intelligent way. The vision moves on then to think about how do we do this at scale? How do we really start to create this as our normal way of doing our training of staff? We said we needed to move beyond one trusted individual. We're getting into that space now. We need to create a supply pipeline of trusted clinicians trained to nationally recognised levels of training so that people are supported to work at the top of their licence. And in the future, in our vision, we see actually where these roles are established already, this workforce are integral parts of pathways. People can't imagine a world without them. The continuity they bring to service, the skills they bring to service and their educational capacity they build within a service has become invaluable. The key delivery of our vision is the workforce looking ahead to see that career. They can see how they can self-actualise, they see how they can deliver their benefit to the system, and they can see they have got not just a job, but a way they can really deliver across the years of working. Patient safety, relentless pursuit of patient safety is absolutely core to the work, and how we absolutely optimise this opportunity we have at the moment. And when you think about the transformational component of this work, our future vision is really taking this opportunity to drive transformation in the workforce. We have a middle career upskilling moment where we can start to really think through what are the skills that we need to develop in this workforce for the future. How do we create the digital champions of the future who are able to really drive forward innovation across pathways? Really valuing mental health, really support our service users and our patients to be the best they can be and recover and optimise their opportunities. Hugely important. How we think about really maximising our role in prevention, in-person centred approaches to care. Shared decision making should be at the heart of everything we do. This workforce, we have the opportunity here to embed that in our learning. When we trained, this wasn't our normal way of delivering care. We've now got an opportunity to support the workforce to really upskill in a whole number of hugely important parts of our development. We also think about how, from advanced practice, we have 4 pillars. We have the education pillar, leadership and management pillar, we have the research pillar, and we have the clinical pillar. How do we really exploit all 4 of those pillars to the benefit of the system? Really understanding how we build educational capacity for all, how we really think about driving improvement across pathways, making sure that we've got research, developing the evidence base, and really showing the impact of these roles over time. And thinking how we lead and deliver the change across systems, across pathways. That is so integral to what we need to do to deliver sustainable and affordable healthcare. Keeping absolutely to the principles of the NHS Constitution and looking at equality for all, equality of opportunity for all of the workforce to take part in advanced and consultant practice roles. Making sure that in everything we do, patient safety is the absolute underpinning part of what we do. This is not one generic workforce. This is not about creating a one-size-fits-all approach to training. Really, really clear that what we have to do is to think through what does it mean to be an advanced clinical practitioner working in surgery or within medicine? What's it feel like to be an advanced clinical practitioner working perhaps within the radiology department or within an ophthalmology unit or as part of the frailty pathway, perhaps in primary care? We've got work happening across all of these different areas and specialisms which enables people to deliver both the clinical skills required by that population, but also that transformational potential of getting the right skill set into the right place of the pathway to better serve that population health need. And for example, you think about the impact of frailty. If we were able to completely rethink the frailty pathway and put this experienced clinician into the front end of a clinical pathway, I think it could be an occupational therapist, it could be a nurse, it could be one of a number of professions who impact positively on the frailty agenda. We could really rethink how we are managing and supporting people living with frailty in the community to stay at home, to actually enable them to stay socially integrated into their local communities and keep them as well as possible in the community for as long as possible in their own homes independent. Huge opportunity to really rethink what clinical pathways of the future could look like. But as part of our vision, there is a moment of opportunity here and a real call to action to all of us to say we have an opportunity. The challenge really is we are the leaders of our time. Nobody else is going to help make this happen apart from ourselves. Let's craft for the next generation what we never had ourselves so that we can really start to think about how do we help this workforce to really find its feet in the system? How do we enable this workforce to deliver its full potential to the system? If you want a motivator, this workforce is going to be looking after us when we're old. There's a certain call to arms there for all of us to make sure that we are supporting this workforce to be the best it can be. And I put it to you as a challenge. It's not really what we can achieve, it's how courageous we can be. How can we really drive this agenda to the full benefit of a system, to the full benefit of a population, and really realise the potential of the moment? Thank you very much.